All right. Good morning, good morning, good morning. How are you? Got it? Got it?
Really good. Yeah, I got it.
We just said really good. Welcome, everyone. You are listening to another episode of Shop Talk with Mel. Today's topic is Think Pink, and we have Dr. Kamilah. She is the host of Pivot and Bloom and also Single Well. Before we get into the Think Pink, tell us a little bit about Single Well.
So the Single Well is a community of sorts. It is the name of my podcast and also the name of my coaching program. So I help single moms embrace wellness through not just focusing on weight, but also mind, body, and spirit. And so that's essentially the overview of what I do. The podcast comes out every Tuesday and has various wellness topics. We're starting to do some interviews, so we'll have a lot of really great experts coming in and talking about different aspects of wellness that pertains to single moms. So really great stuff.
Awesome. Now, when you say Single Well and you say mind, body, and soul, you said,
spirit.
Or did I add that?
Mind, body, and spirit.
And spirit. Oh, spirit is more important than soul. That's far greater than soul. I'm trying to get this stuff together at the same time, make sure our sound is good.
Fine.
Okay. Now, Pivot and Bloom, are you still doing that?
Yes, Pivot and Bloom has become the umbrella for my company. So Pivot and Bloom Wellness Collective is what I call it. The Single Well is a branch of that. And so Pivot and Bloom podcast is still on the same platform as Single Well. So if you go back, it's kind of like Single Well is the second season of Pivot and Bloom.
Okay.
So I shifted it to align with my coaching program, but all of the Pivot and Bloom episodes, there's a full year of episodes there, are online along with the Single Well. So if you look up the Single Well and then you go back, you'll get all the Pivot and Bloom episodes as well.
Oh, cool. Now that sounds pretty good. That sounds pretty good. All right. For those who are joining in and wondering what is Think Pink, you guys should know by now that October is Breast Cancer Awareness Month. Now, I wanted to do it, of course, in October because it is Breast Cancer Awareness Month. The thing is so interesting how sometimes you'll have people thinking that they need to do things just because it's that month and not the entire year, not realizing like Breast Cancer Awareness Month is to remind you if you're not doing it. You know what I mean? It makes you aware. It doesn't mean this is the month that we do it and then we do nothing the rest of the year.
Yes.
So, Dr. Kamilah, you know, I was about to Dr. Mimi.
Yes, that's my family name.
Yeah.
So all my family calls me Dr. Mimi, so either one's fine.
Okay, all right, good. But her government name is down there below. I was like, wait, Dr. Mimi said this. How important is it to do breast exams monthly?
And this is my opinion, I think it's very important. The medical community kind of stepped away from that a little bit. The idea was that if women were doing that, they would find more abnormalities that weren't true abnormalities, and there would be confusion and, distress from that. But I continued to tell my patients, and I say continued past tense because now I'm not doing traditional family practice. I'm using my skills elsewhere. But when I was still in practice earlier this year, which I finished up an 18-year stint of that, I always told my patients to check monthly because I had several patients who found their breast cancer by checking. And the reason that's important is because we always say we should know our bodies. We should know what's going on with our bodies. And so if you have a change in your skin, you notice that right away, right? If you start having any kind of a symptom, you usually, oh yeah, I noticed I didn't have that yesterday, so something's going on. The same thing is going on with your breasts. And the issue is that a lot of times we don't think of that as something we need to be doing. It's kind of like they're there, but well, I'll just get in and out of the shower and be done. And so something that we encourage women to do is in the shower, when you already have everything off, between periods, you should be checking your breasts monthly, because then you get to know your breasts well. And then as soon as there's an issue or a change, you can go and see your doctor. And most doctors are going to want you to come in, even if you don't think it's a big deal. A lot of times it's not a big deal, but you definitely want to get to know your breasts, and they feel different throughout the month due to hormonal changes. So it's important to do the check for tumors at that 2-week period between your menstrual cycles.
Okay. Now, when you say you want to check for tumors, because some people may feel something different, just like you said, the hormonal changes. Go into a little more detail on that, because some may mistake, the hormonal changes for, oh gosh, I got breast cancer.
Yes. So the breast, tumor, first of all, a tumor is, I always have to watch my medical words, but a tumor is a growth. So a lot of times we have come to tie in a tumor to mean cancer. It does not always mean cancer. A lot of times it's not cancer at all. So a tumor is any type of overgrowth of tissue in the body. So any kind of lump. A lot of us have those, like what we call lipomas or fatty tumors, we call them. Fibroids are a type of tumor, but they're benign, they're not cancerous. So a tumor is just a growth. So the thing with women is we have all of these changes in our breasts throughout our cycle. So that 2-week period between your menstrual cycles, if they're regular, sometimes it's harder to tell if you're not regular on your cycles, they're less likely to be influenced by those hormonal changes. So when you get closer to your period, you may have some swelling and discomfort and things. Those are those hormonal changes. So you'll feel more lumps. If you have lumps that are somewhat abnormal but benign, like something called a fibroadenoma, which is a dense kind of tumor, meaning it's like a tough, harder feeling tumor, but not quite like rock hard. A lot of women have those, and those can actually swell and enlarge during your menstrual cycles or around your menstrual cycles. So it's important to check between periods. So 2 weeks after your period is a good time to check, because you will get misled by those. But it's important to know how they feel and know what they feel like. And if you notice it and you didn't notice it before, go see your doctor. This was why a lot of people started to recommend against self-breast exams, because it was like, well, people are checking and there's all these different changes that happen and they get confused and concerned and so forth. But I think it's better to check than not to check. So yes, feeling something does not mean you have cancer. That most often you don't, but it's important to get it checked. Because I know a lot of people will also not go in because they feel something, they're scared and they're like, forget it, I'm not going to deal with it. And the sooner you find it, if it is cancer, the sooner you find it, the better. So that's also important.
That's funny that you should say that. Yes, there are those that are like, no, I don't want to know. So they won't go to get checked out.
Yep.
Now, when you say that you guys are steering, and this is just your opinion, steering away from the monthly breast exams now, elaborate a little bit.
So the general guidelines are confusing at the minimum. So there's multiple different American College of this and that you'll see around that have different ideas about different screening treatments. So over the last few years, we've changed how we do mammograms, the timing we do mammograms, and they don't really agree on how often we should be doing them. The same thing has happened with prostate, where they're now saying that the prostate level in the blood, the PSA, is important and the exam is not. If you talk to a urologist, they're going to tell you, yeah, sometimes you need to do that exam. So there's just different things. The Pap smear is a big point of controversy. A lot of women are noticing their doctors aren't doing those as often and getting upset by that. So the whole idea behind that is, are we screening too much? So it's a real, it's actually a patient-centered approach of, are we telling people to check too much for these things? Are we doing too much screening? And so out of that came this idea of not necessarily telling women not to do their breast exams, but maybe not as often. And this was something that came up years ago. My experience has been that I and a lot of my colleagues continue to tell women to check their breasts just to make sure. We do it in the office. Your doctor should be doing that as part of your well woman exam. If you go in, and that's just your Pap smear basically. But even if you don't need a Pap for whatever reason, you should be getting this yearly exam. But once a year is not quite enough to get a good feel for the breast. The doctor will have a better idea of what's abnormal and what's not based on how it feels, and will take the steps. But sometimes, we may not catch that. We may not catch that there's an abnormality unless it's a really obvious abnormality. And so that month-to-month thing is really important. So yeah, so there's a lot of that nuance of, well, maybe we're checking things too often. It's definitely controversial for sure.
Like everything in medicine, right?
Yes, yes, every single
my
thing.
thoughts to myself.
Every single thing, yes.
All right, so tell me, well, actually, I can share an incident that actually occurred with me, and I went in for my exam. Now, I would do the monthly exams because it's been a long time, so I continue to do it. And I felt something under my arm. And I'm like, oh, is this a cyst? Sac containing fluid. You know, I'm like, okay, is it an ingrown hair? You know, it could be from an ingrown hair, whatever.
There's a lot of things.
So I wait. And then I go in. So she's like, okay. And she paused. Well, I'm a little concerned, you know. I'm like, okay, wait a minute. What's going on? And having a medical background too, I'm like, wait a minute now. And I know her, I call her by her name, Tara. I'm like, wait a minute, Tara, wait a minute, slow down, hold on. So I think that's where that saying, ignorance is bliss. Like if I didn't know, I wouldn't have thought nothing of it, you know. But she checked it and then she's like, okay. They ended up sending me a letter or whatever. Then I had to get a mammogram. But besides that, then I had to get an ultrasound. And then finally they pulled it. And I usually don't take in a lot of caffeine, but I have been. So let me tell you how grateful I was for the caffeine, for the dew, the Mountain Dew. Like, that's what it was. And it ended up being nothing. But I was thinking, like I said, it's kind of when you have a medical background and you sit there, you start thinking like, oh, wait a minute, what could, worrying myself nuts. Okay, like what is it? Wait a minute, maybe I should have came when I first thought. I fast forward the story because we ain't got that kind of time. But you know, I'm like, well, maybe I should have waited. You know, maybe I should not have waited and just went in. And I'm like, okay, wait. But then I started working night shift, but I had to stay awake. So that's what it ended up being. It was the caffeine. So mine was, I was so grateful. Mine was nothing but put down the Mountain Dew, and I have done that. I have been clean for 2 years now.
Oh, good.
Good. But the waiting process, when you said that, it triggered, and it was like, okay, even though I'm thinking, ingrown, you know, I'm self-diagnosing myself, you know, I'm like, just like, oh, okay, well, that's that. Where there are people out there that feel like, okay, I don't want to know. If I know, I might die sooner. And I actually had a conversation with somebody versus, if I don't know, then boom, then I'm just, you know what I mean? You just drop dead in the family like, wait, what happened? They were doing da-da-da-da-da. So speak to that person who feel as though, who are afraid to know, because that's what I think it is.
Yes, that's a really good discussion. You know, there's a few things to consider there. When somebody is scared, that's very normal, first of all, to be scared. It's not abnormal. Don't feel like, I mean, I've had people tell me I'm a big baby and I didn't want to, you know, no, just don't think like that, because a lot of times as medical people, and you may have experienced this, like I spend more time going around and around about something because I already think I know what they're going to do. So then I waste time getting there because I'm like, oh, this is just this, they're not going to do, you know, so we do it too. So when you're afraid and you're just like, I don't know, that is normal, because it's the unknown. Anything uncertain it creates fear and within us. But also, you know, I think the perspective of not wanting to know has to do with mindset. And I know you talk a lot about being inspired and having a positive mindset. And what we find is that a lot of people that have gotten a not so great diagnosis and they have a positive mindset surrounding it, they tend to do better. And so thinking of it that way versus going into it negatively is key. Very much easier said than done. But if you're worrying, if you're stressed about it, you know, it's normal to feel that way to an extent, but finding an outlet for that, journaling, other, you know, whatever you can do, listening to music, whatever that is, to just help yourself get through it and think, I can't control what's happening right this minute. Like I can't change what's happening right this minute, but I can control how I feel about it. It helps a lot, because those stressful things, and like you mentioned, the sugar, caffeine, we can talk about those things as well. All of those things contribute to ill health or poor health when we think about that overall. So you don't want to add stress to that pile. And like I said, it's way easier said than done, because especially if you have family, you're a mom, you have all these things that you need to be there, people you need to be there for, your mind goes straight to the worst of the worst. And I would encourage anyone going through that to not do that, because like I said, the majority of the time when I saw patients with, and I've seen thousands of patients over the years, and when women would come in with breast lumps, we would almost always send them for some type of imaging just to make sure there was nothing going on, meaning, X-ray or not X-ray, ultrasound or mammogram, things like that. But most of the time, it was nothing. So usually by the time you work through all that whole spiral in your head, majority of time it's stress that's not founded. You don't need to be worried. And there are, is worried enough to go get it checked out, but not worried enough to make yourself sicker or create more problems. So yeah, mindset is key.
Okay. Now, if someone, and you did cover that, but I wanted to concretely put it out there for those who really want to know, straight with no chaser. If for those who find a lump, and they are not sure, but if they find a lump, what would be your recommendation?
If you find a lump, definitely keep track of it. So by that I mean, I can't tell you how many times, it's kind of funny, but people would find a lump somewhere, might not even be the breast, it might be anywhere. And then when they're in the doctor's office, they cannot find it again. So even if you have to get, it's like, it was here, I don't know. And our bodies are always shifting and changing. So it could be that it just moved a little bit. So you may want to mark it on your skin. Like, use something that you can wash off easily, of course, but maybe mark on your skin where you feel it, or really pay attention to the area of the breast. So medically, when we look at the breast from, looking straight on, we divide it into 4 quadrants. So kind of understanding which area it's in, or like if you were looking at it like a clock, where 2 o'clock, 3 o'clock, that kind of thing. That may be a harder concept for a lot of people, but just knowing where it is, marking it if you have to, and paying attention. Now the other thing is, you don't want to once you feel it, you don't want to touch it every day, because our body will start to get irritated. If you have a part of your skin that something keeps rubbing, you have a bracelet or something that rubs the same spot, it'll become sore and swell up and stuff like that, because you're rubbing that area. Same thing happens in the breast. So once you find it, it's okay to kind of keep track of it, make sure you still feel it where you feel it. Even if you don't feel it anymore, I would still say go in and have it checked out, because most likely what I would have done as a physician would be typically like, let's just go ahead and do an ultrasound, a mammogram, something to make sure there's nothing there.
Okay. Can you give us some symptoms?
Symptoms? Yeah. Unfortunately, there's not always symptoms. So something you mentioned earlier is an important one, is a lump under the arm. That's one we don't think of. We don't think of that initially. And this becomes important with your exam. So you're not going to just check your breast itself. You're going to check the tissue around it. You're going to check underneath it, like where your underwire goes. That area of the chest is important. The upper part of the chest, your pectoral muscles, is important. The axillary area under the armpit is important. And so a lot of us have had, a lot of women have dealt with those lumps and things under the armpit that are a lot of times benign, or things like what we call hidradenitis, which is like an inflammatory condition that causes swelling and cysts. And so you may have those things, but feeling under there is super important. So if you feel a lump, especially if you feel more deeply under there and there's a lump, any kind of lump there, that's important. Of course, feeling a lump in the breast, we talked about that. Some people may have vague symptoms. They may feel more tired, but everybody's tired, right? You may have those really vague kind of things that are hard to describe, and you're not feeling well overall, go see your doctor. But there's not always a lot of symptoms. Now, sometimes you can feel pain in the breast, like I said, around certain parts of the cycle, but pain is almost always benign. So like if you have pain, it's usually not a bad thing. Like it cancer or something attached to that. Cancer tends to be painless, but that's not always the case either. So if you have a new pain in your breast, go get it checked out. Any change in breast size, because sometimes they can start to swell or change in a certain way if there's something abnormal there, getting that checked out. And I'm trying to think what else, an abnormal discharge. So most of us, if you breastfed, you know what that's like, or if you have a baby, your breasts kind of leak and things. And there's a certain way that that looks. It's kind of like a clear white, like breast milk. If you start having that and you haven't had a baby in a while or have any reason to be doing that, that's abnormal. And especially if it's bloody or it has a funny color to it, that is something to get checked as well. Anything other than like just that clear white kind of thing. If you have that and you haven't been recently pregnant or anything, like I said, that's something to look at as well. And you may not see the blood. The blood may be so tiny, that microscopic, we call it, where you can only see it under a microscope. So, or with certain special testing. So make sure you see your doctor if you have any new nipple discharge. Some ways that we know that it might be more abnormal than not is if it's on one breast versus the other. So like if one breast is leaking, that's definitely even more of a reason to go in, things like that. But those are some of the main symptoms you might have, but it can be hard to tell just based on symptoms with breast cancers.
Okay, is the inverted nipple still a symptom or no, or a sign?
It can be. It can be. We have those. That's something to look forward to. So if your nipple, some people have inverted nipples anyway. So if they look like they normally look, this is why it's also important to look at your breast in the mirror. Sounds weird to a lot of us, but just kind of being undressed and looking at your body in the mirror, is important, because your breasts may shift. And sometimes if there's a tumor inside the breast, like a malignant tumor or a cancerous tumor in the breast, it may pull on those ligaments and cause what we call dimpling. So little dimples in the skin in the breast. So you want to lift your arms overhead and look that way, and also normal straight on. And so that is something that can definitely be an abnormality. What was the question exactly again? Because I got off the.
I went all the way over. It was what to do if you find a lump. You answered.
Okay. Yeah, so
you answered it earlier, like, go get your
okay.
Just be on the safe side,
Yeah, so you can see some dimpling and things like that, and so that may be something else that's abnormal. A lot of people also, we're adults, you may have an encounter with your significant other and they may feel something. I've seen that happen too. So having them in the know of how your body should feel is important as well. So.
Now that is something that we as females may deem normal.
Mm-hmm.
Just like going through emotions and some mothering, working, you just like going to your significant other, like, wait a minute, that was not there.
Exactly.
And we're not paying attention to it.
Mm-hmm.
And they may find it. I know somebody that happened to her husband. Who found it. And I said, oh, so that is important.
Very important. They'll tell you before anybody else. So.
Right. Navigate, explore.
Exactly. Exactly. Yeah.
Look, and then there's some that don't, just like, oh no, I don't want to see, turn the lights off. Not turn the lights on.
Right. Right. Yeah. And I mean, it's the same, doing that for him as well. If your significant other, your husband, whoever, it's important to do that for each other, because there's things we don't notice because we're just going about our day, and so yeah.
And you're right, going about your day, just busy being. Now, for the how do I want to word this? I'll just forget it, Mel. Do you? For the people doctoring, Google doctors. There you go.
Yeah. Google MD.
Oh my gosh, this is this, or I Googled it, and this says this. What would be? Speak to those Google doctors.
So, this is a tough one because, as we all know, there's a lot of brokenness in the medical system. There's a lot of miscommunication between patients and doctors. There's a lot of, mistrust, which has I can't deny that there's mistrust, and it's founded in some cases, where there's things that we've done that hasn't been on the up and up. There's just a lot of change in how we deliver care. And what I discovered, and I've been on both sides of this. So when I was in daily, day-to-day family practice, seeing 20 patients a day, it was a hindrance because people would come in with articles they printed off and they're talking about different stuff from Google. And I always called it like Google MD, DDS, PhD, you know, all of that. Because people find things and they're like, oh, here, this is what I have, or this is what I think. And the shortcoming to that is that it redirects your doctor's thinking. So even though that may be what you want in the moment, you really want your doctor to use their full breadth of knowledge to address your problem. Because if you focus them in on, oh, I have a thyroid issue, or like in this case, I have breast cancer, they're going to be, they're human. So they're going to kind of be led down that path because they also want what you want and want the best for you. So they're thinking, well, they're really concerned about this. Let me make sure this is not the case. So I usually would tell my patients, like, you know, I understand why you're doing that, so forth, but it really helps me not to have that distraction. Now, that being said, it is important to know about the human body and understand why things work the way that they do and have a working knowledge coming into your doctor, because then you can have a more detailed discussion about what's going on where you really understand. And if you don't understand, your doctor should be able to explain it in a way that you do understand. So now that I'm kind of more in the holistic space and doing things that have more to do with communication with patients, I realize that it is a sign that that patient feels they're not getting what they need. So when you start looking in Google, we all do it. I do it. I'm a doctor and I do it. You look at Google to get, you know, let me see what's here. The problem is it's very broad. So even reputable sites like WebMD and things like that, they have to give you a very broad overview of what causes fatigue, for instance. And in that list is going to be cancer and really horrifying things, because if they just say, oh, it's usually just that you need more sleep, there's somebody that's sitting at home with a life-threatening illness that will just say, oh, I just need more sleep. So they have to put all of that stuff in there. And so I tell the people that do that, definitely do that to get more information. Feel comfortable talking to your doctor about it, but don't use it to combat the doctor, if that makes sense. Don't use it to oppose the doctor. If you're feeling like that, if you're feeling like you have to oppose them, yes. If you're feeling like you have to debate with them, that may not be the doctor for you, because then you're feeling, you know, you're proving your point, they're proving their point, and it's just like a debate, like you said. So yes, I think it is important. And I, as a physician, have learned a lot from Google, so to speak. I mean, it's more than that, but just learning more about nutrition in spaces outside of medicine, because medicine didn't give me that. So I totally understand where people are coming from with that. But now I see that it's more of a call for help, a call to action for doctors when patients are doing that. So it's all in the approach, you know, it's all in how you deal with it. And I think it, you know, and education is my passion. So people really understanding is important, and Google can help with that, but you just have to have the right sources.
Now I have to ask you a question. How do you, and I just want to know, when you have that challenging patient,
mm-hmm.
How do you ask them not to come back if they're constantly challenging?
I've never been asked that question publicly, but yes, that does happen. And I was always really humble. Like I'm confident in my knowledge. I know what I know and what I don't. So I would always tell my patients, you know, hey, I don't understand that particular thing. I don't know what's going on with your body right now, but I'm going to figure it out, or I'm going to research it and get back to you. So I was always open with that. And so if I had someone that was kind of constantly, you know, that kind of battle debate thing going on, like I know more than you, you know more than me kind of thing, I would just sit down with them and say, you know, it seems like we're not on the same page. You know, what can I do to improve that? And then see what kind of answer I get. You know, is it something I'm doing or not, or so forth? A lot of times the base of that is actually fear of some sort. They're afraid of some disease their mom had. They're afraid of, you know, getting sick or having some issue. They're just afraid because they're not feeling well. Whatever it is, there's usually like fear at the base of that. They may feel inferior because of just their own ideas of what a doctor should be doing and so forth. But when I get to the bottom of it, it's really just like they're, you know, and they say, oh, I don't, you know, and I say, it seems like when this happens, it seems like you don't trust me, and trust is the foundation of the patient-physician relationship. If you don't trust me, I can't help you genuinely. So I'm okay with you going and seeing another doctor, even if it's temporarily, to get a different view. Because sometimes if you're seeing that same patient for 20 years, you know, you don't have of you. It's kind of like how we are with our family. You know, you can only see things a certain way, where somebody else can come in and say, oh yeah, it's probably this going on, or oh, did you know that they had this going on? So that was how I dealt with it. I was very open to people seeking other care, and I would say I feel like another physician might be better for you. Another physician might be better able to help you with this problem, you know. And I always had pretty good reception with that. And a lot of times it was that they loved me as a doctor, but there was something either they felt they weren't getting, or that fear thing. They were just like, I'm just so afraid of this and that, or you don't seem to do this, and my other doctor did this kind of thing. And I'm thinking, you know, so there's a lot of those misconceptions. But yeah, sometimes you have to have those discussions. They're not easy. But yeah, we do have them. And usually it turns out well. Sometimes you just part ways. I always tell people it's like a relationship. You know, if you're with a person and just not gelling, after a while, you've got to sit down and decide, are we going to continue this, or are we going to move apart?
Okay. If you want in on this conversation, feel free to do so. The phone number here is 619-902-2287, 619-902-2287. And our guest today is Dr. Kamilah Williams. Dr. Mila, you guys can check her out on your favorite podcasts at the Pivot and Bloom and the Single Well. So you guys check that out. We're going to go to a viewer, long-time listener. Thank you. I don't know if this is like a question or a statement. You figure it out. Okay.
Okay.
I was with my doctor for 30 years. And when I come in, he's like, oh, okay, thank you. I sit down, I get my vitals taken, and I don't feel well. And he'll say reschedule for blah, blah, blah. That's what it says.
Okay.
I don't want to misinterpret. So for you listener, let me know if I'm right or wrong. I'm going to paraphrase it a little bit. So it sounds like you had a relationship with this physician. 30 years is a long time. You know something is wrong with your body. They know you, and it's just like, oh yeah, you're okay. And please let me know if I'm wrong. But usually, isn't that like your family or your parent? They're like, oh yeah, you'll be okay. And you're like, no, this is different. And I can't speak for your position, but I don't know your situation. You'll be mad at me, but you know how I roll in your way. When you feel like people are, and I'm not speaking about you, but if you feel like, you know, your complaint, like the hypochondriacs, they are real. They're real.
It's a real thing.
Put on a question, I'll write it down. It's like,
yep.
Okay. And if you are that person, then, you know, the doctor might brush something off that may really be serious this time. So in that case, would you suggest, and let me say this, the views of the host, myself, or any of the guests on Shop Talk with Mel are just that, yes. Okay? We'll speak to that situation.
Yeah, it's such a good question. This happens a lot, and it's multifaceted. There's so many things to consider. The first thing I would say is that a lot of us, and I dealt with this when I was leaving my practice, trying to get patients in with doctors that they felt comfortable with. And so as an African-American and Black physician, I had a lot of Black patients that wanted to see another Black doctor. And so that was something that's lost on the system at large. They know that that happens, but that gets lost on them. And I'm not saying that that's the issue here, but that's part of the problem, is that people find a doctor that they like and they want to stay with that doctor. But what's happening is the doctors are getting tired, burnout, you know, you name it, and they're starting to move on. So a lot of people are coming in and having their doctors move on. And so I say all of that to say that there's a lot of new doctors. And so I ran into this when I was leaving, that I had a list of doctors. A lot of them were new doctors, meaning they were fresh out of residency, which is you 3 years as a doctor for family practice. You're 3 years as a physician under the guidance of what we call an attending physician. So a physician who's been doing it for years typically and has experience. And then you go out on your own. So they're very well trained, depending on where they come from. They've done all the work, but a lot of people shun them because they're a new doctor. They're young, they don't know. What I will say is they tend to be up on the newest things. They tend to be more proactive, not against anybody that's been practicing. Like I said, I was out there for 18 years. So, but you can get complacent. And especially when you know someone, it is kind of a double-edged sword. You know them well. So sometimes, you know, if you're like, oh yeah, this is, I'm not getting the sense this is a big deal because I know this person. So it's not coming from a bad place. But then again, it could be, you know, that they're just not looking more deeply because it's become an easy thing. You know, they see you, you have the same things, you do what you do and you leave. Whereas a fresh pair of eyes could be important in that situation. So that's where I tell people, you know, be open to, if you have to, switching to a new doctor. I know that that's a very emotional thing. And I'm not saying that you should switch your doctor necessarily based on what you just described, but it does happen. The other thing is everybody is rushing now. Medicine has changed so much that most people don't have a lot of time to spend with their patients. We're just not given that amount of time. We're given certain guidelines we have to follow, and you know, these things we have to check off, and that's it. So it's just not a natural environment for those kind of things. And so when you start thinking about digging into a problem, it is hard to do that in a 15-minute visit. And I mean, 15 minutes is from door to door. So coming in the door, getting checked in, getting in the seat, talking to the medical assistant, talk to the doctor, and then you get your labs or whatever, and you're back out the door. The visit is scheduled for 15 minutes, but you probably are getting a couple, 5, maybe 10 minutes with the doctor. And so sometimes it is like, hey, you know, I think you're going to have to come back to go over this. And I know from experience that we would do that, and then they would come back and they would have something else, and we would focus on that for those 10 minutes. And not get to the thing that they really wanted to, because they forget, or we forget, or we all forget. So there's a lot to consider with that. But if you're really feeling like something's wrong, because I've also had the experience of patients that I know well that come in and they feel they're doing okay. And I'm like, nope, something's, you don't seem like yourself. What's going on? And then, you know, they'll tell you, oh, I'm just kind of tired, or I just feel sick, or, you know, and then I'll run labs or do some kind of test and they have something major going on. So all of that is important, but you always have to be thinking like, okay, I know that my doctor cares for me. I've been seeing them. I mean, obviously, if you've been seeing them for 30 years, you have some type of a relationship, but it might be time to either have a frank discussion and say, you know, I don't feel like you're listening to me. I don't feel like it, you know, and if the response is key. If they're very, you know, put off by that, they're insulted by that, you know, and you're coming at them respectfully and all of that, then again, it may be time to move on. But yeah, there's a lot of factors at play with that too. So it's hard to say, you know, without being in the room, what might be going on.
I like that. I like that because you do tend to, it is hard when, it is like a relationship too, you're right.
Mm-hmm.
It is hard when you build a rapport,
mm-hmm.
you know, with your physician. And it's like, okay, you're not treating me the way I think, even though, you know, and like, you know, I'm a nurse. So it's like, I know you know more because I'm only focused in on what I'm focused on. And that is the truth, because there's so many different aspects of nursing is in just in medicine overall. And I'm like, can you refer me? I'm telling you something's going on, and I'm looking at you like, okay, well, you need to know. No, I need a little more help. I mean, you know, and you know your body. You know your body. I gotta give you that viewer's response.
Okay.
Okay, I'm gonna go back to the viewer said, "Shut up, Mel."
Hilarious.
Like, shut up, Mel. She's like, "Thank you, doctor. I appreciate that." So I think that hopefully she does go ahead and do that, because it's like a relationship. And it's like, how do you break off? And you don't want to end the friendship or the relationship, because most people, you know, you trust the individual, you're looking at them like, okay, you know, I trust you, but I need a little more, but I still want to communicate with you. How does that, how do you deal with that? That's like, that's, you know what I mean? Are they going to get upset? If they get upset, what's going to happen?
And it's tough in this climate too, because it's not as easy to switch right now with COVID and everything going on. Doctors are swamped. They're scheduling in 3-4 months out. You need stuff now and not in 6 months. So it's really hard to switch. And a lot of people, insurance, I mean, there's so many reasons why people have these barriers to getting good care. And so that's tough to say, oh, I'm just going to go see this other doctor, because that may not be realistic depending on where you are to go just go get another doctor. But I think, you know, this is something I've been really working on, my wording and my, like, how I can be an advocate, because I've been on both sides. You know, I've been in that position of being the person seeing 20 patients a day and doing all of that. Also been a patient, also been, you know, somebody who hasn't had to do that. And I think that there's just a lot of problems with communication. And I understand where the doctors are coming from and feeling assaulted with some of this stuff, because you have all this stuff on your plate. People are asking you all these questions that you're not prepared to answer. And it's just tough, you know. And then on the other side of things is, as the patient, you're like, I just need to know more. I need more done. I need you to look at this a little bit more closely. And I just think bridging that communication is important until we come to a conclusion on that, which might take a long time. Medicine is a big bus to turn around. So, you know, really paying attention to your doctor's response, and as painful as it may be, I would think of it, and again, back to the relationship thing, if you tell them that you have concerns and you're dismissed, then that's probably a clue that you need to start thinking in future. Now, if you're in a position where you're on medicine and you have things that you need, I would not antagonize that person. I would continue to go and just do what I need to do, but schedule with that new doctor so that you have an appointment. Continue seeing your doctor because you've been seeing them for a while.
Okay.
You just know that you need to make that shift.
I'm glad you said that. So now, in the times of COVID, now it's not a good time to do the switch.
Yeah.
Okay. I'm like, you're freezing up on me, Dick. I think you hear. Look, I'm sitting there speaking the way that, yeah, I can hear you a little bit. It's just choppy. But I got you.
Okay. That should be better now.
There you go. If you want in on this conversation, feel free to do so. 619-902-2287. Some symptoms of breast cancer. Now, hear me well. Not saying that you actually have it, okay? But these are some symptoms. Dr. Mimi said sometimes you don't have to have symptoms. So that even puts you, like you said, fear being the underlying issue as far as going and getting treatment. Sometimes you don't have to have symptoms, a lump in your breast, discomfort, inverted nipple, discharge, bleeding. What else? Oh, swollen lymph nodes. Tell me about that. Tell the people about the swollen lymph nodes. Well, that was
yeah. So lymph nodes are really interesting. We have them all over. So they're normally there. They're there to help clear infections and clear abnormalities in the body. So that's part of our immune system. It's very important. We've all gotten a PhD in the immune system over the last couple years. So, but the lymph nodes are important because they're little like hubs for cleaning things up. And so you can feel them if you just feel around your body. You might feel little lumps, and a lot of times we get worried when we feel a lump, but they are there normally. They swell if there's an infection, if there's something it's trying to clean up, it swells, it gets more busy. So you think about a hub, like an airport hub. So if you go to like Dallas, Fort Worth, and those airports are just buzzing all the time because a lot of people are collecting there. There's a lot of things coming in and out of there. That's what a lymph node is like. And so what happens is, you know, if you have cancer or something like that, those lymph nodes can swell. So if you've ever had like a throat infection, you know, a cold, anything like that, and you get those swollen glands, your doctor asks you, have you had swollen glands? Those are lymph nodes. And what it is just your body reacting to something. What's really interesting about it is that where they are determines what it's clearing up. And there can be multiple things coming to one hub. So if you see a bunch of people at the airport, they didn't all come from Chicago. They're coming from all different places, but usually regional, you know, not always, but usually regional. You know, a lot of them probably are from states right around that area. And that's how you want to think about the lymph node. So the lymph node in the neck might drain different areas of the head, the ears, things like that. But they have little tools they have like an assignment, so to speak, of what they clear. And I say all that to say that the lymph nodes for the breast are kind of all around the breast. They're in the pectoral area. You might feel a little lump there. It could be a tumor, but it could also be a lymph node. In the armpit is really important for the breast, and not just superficial, but really sticking your finger down in there to feel. That's important because that's where the breast drains to. So if there's an infection or a cancer in the breast, it'll go to those lymph nodes. The key is typically they don't hurt. again, if there's not pain, that can be more of a sign of a problem. Not always, because we have lumps in our breasts normally. So don't think that that's something. But yes, if you feel a lump there, you feel that can be a sign that the body is trying to eliminate something abnormal in the breast. And so you want to look for that. But usually, yeah, the chest, sometimes what we call the supraclavicular nodes, the ones under the armpit, the ones that kind of surround the breast, can be signs that there's something going on. Lymph nodes are also important because if the cancer gets into the lymph nodes, the cancer is then more serious as well, because it's starting to spread, because lymph nodes communicate with the rest of the body as well. So that's why that's also important to have that checked out.
Okay, when you think of breast, you think of female. When you think of chest, you think of male. So let's talk about the men with breast cancer.
Very unusual. We do see it. We do see it though. It's not the most common type. It tends to be familial or genetic. So the risk is increased if your dad had breast cancer. For a woman, if your father or someone in your immediate family has breast cancer, it's more of a risk, especially if it's a guy, it's more of a risk. But men do get it. Men tend to be men are funny. They're just funny. But they tend to think of that as a female disease. So telling them to do a breast exam is like, really, why would I do that? It is very unusual in men. So that's not something you're going to find often. And there are different things that cause the breast to swell in men. We think that's not the case, but they do. That's a gland just like women's breasts too. But they definitely need to be on lookout for that. So the main thing is if a man feels any change in his breast tissue and his pectoral muscles, anything unusual like that, he should also be aware of that and not be offended. I've had people be offended before. Like I've had men with changes and I'll say, well, let's do, ultrasound. Let's do, they can do a mammogram. It's a little different, but they can do that. Men are like, that's a woman's disease, so that's a big misconception that men can't get breast cancer. Men also can get breast cancer.
Okay. And they don't have to have man boobs.
No, they don't. And there's probably, and I'm just speaking on just thinking through that, there probably is more of a risk with that because that tends to be associated with more hormonal issues, something called insulin resistance, things like that. Think that the main problem that leads to diabetes and different chronic conditions, there can be a correlation with that, but I don't know the numbers or like specifically if that's truly a high risk for men. But yes, they can have more breast tissue and have a problem within it. But even a man that has, pecs and looks muscular can still have an issue in the breast. So any type of a lump or any abnormality should definitely be checked out.
Okay, I wanted to put that out there. Look, the viewer said, she was like, I told you to shut up about me being a hypochondriac. Some people are though. You know what I mean? And then you want to debate with the physician, but I am a firm believer. This is just me personally. We are our best advocate, and we know our bodies. Now, if you do have an issue, just like Dr. Mila said, sit down with your physician and say, okay, I don't think that you're taking me serious, or whatever the case may be. I quit my doctor. I did personally. I did because I felt like it was a little bit more. And a friend of mine, and when you sit and you're talking about a situation with your coworker, and I'm like, no, this is something more, something is going on. And even though we're talking about, breast cancer today, because it's Breast Cancer Awareness Month, with my diabetes, and I knew it wasn't worth it. And being in that field, I'm like, I had access to everything. I was like, no, something's not right. I wasn't able to write. All of a sudden I would write, and then all of a sudden it was like different.
Oh, wow. Yeah.
And I'm like, okay, wait a second, what's going on? And I got into a fender bender. So I like contributed to that, like maybe nerves from, my hand being on the steering wheel, doctoring, pretending I'm a doctor. Okay. And then I checked my ketones, and it was black. And it goes up to the brown. It was so dark. I was like, something's wrong. So I go to the ER because the emergency room, I'm trying to find, you know, before back in the day, they used to refer you to specialists.
Mm-hmm.
They don't do that no more. This is what they told me. They said, go back to your primary care physician. I'm like, I'm trying to get out of here.
Yeah. Yeah.
And I'm telling her the situation. And I'm like, listen, please refer me. She's like, oh, I can do it. I'm like, no, something is going on. And then, you know, getting my eyes checked, you know, getting my little eye exam. And I'm like, how is it changing? Like, I really can't see something's going on. Go to the emergency room. And you just, and I'm speaking from a patient's aspect. You just can't go, you just can't go off of, like you said, the hub, when you use that analogy for a lymph node. You can't just put everybody in that. And that's how I felt. And here's what happened. And I said, and I know. And I'm like, listen, it seemed like, and my description was, it seems like a curtain is over my right eye, like something, you know, pulling a shade. You get it. And I'm not talking about, I'm not saying, yes, I am. I'm not saying that these young people, you know, working in triage, you fresh out, like, oh, okay, well, I didn't read this in the book and this is not it. But if you old school, you kind of know. So I go in, blood sugar, when they drew my blood was over 800.
Oh, wow.
Right. But out front, I'll have a seat. I'm like, listen, like, I'm not trying to be blind. I talk too much. I need to see who I'm talking to, you know? Like, and then when they did that, I was like, but I was talking to my primary care and saying, listen, oral meds is not working. So they finally got me to I had to switch. I switched to my old doctor because he didn't accept the insurance that I had. So that's why I had to do the whole switcheroo. And then I called because you build a rapport, you know, and once you, and let me say this, once you build a rapport and you are friends, you know, I feel like we are friends, you're not gonna leave your friends stuck with a bill, okay? That's not what you do. So he and I are friends, and I'm like, listen, this is what's going on. He said, I'll refer you, because that's all I wanted was a referral. Refer me to an endocrinologist.
Yeah.
And they drew my blood and they realized that my pancreas wasn't working at all. So the oral meds wasn't doing anything for me. I'm just like something's going on. And now I'm treated properly and I feel good about it. I mean, it's annoying if you hear these beeps and all the little alarms going off. That's me, you know. And I was happy that I finally got the referral. Yeah. And it's like, okay. And it was bad. It was so bad. That's why I'm on an insulin pump. That's how bad it was. And it was like almost a year. And I'm like, listen, I was like, I have to do something. So that's why I say we are our best advocate when we know something is going on. And I appreciate you saying that. You got to know when to sever. We're still cool. You know, she's still cool, but I'm like, listen, I can't afford your plant at the funeral talking about she was so nice. You know, I need to do what I need to do for me, okay?
Right.
You know, I don't need you standing up there talking about, you know, telling my children I was a nice person, you know. I got stuff to do. So I appreciate you speaking on that. Now, this is where I want to go with the next one. When we talked about the lymph nodes, I want to bring it back a little bit. I have a listener that's asked the question, what does it mean? Or let me read it. I don't understand metastasized cancer. Okay, go ahead.
So cancers always have a primary, and that means that that's where the cancer started. The complication comes in, you know, we hear about cancer spreading. So we all know that there can be cancer and then cancer spreads. So essentially metastasize is just the word for spreading, but it usually means like a more significant spread to multiple areas. So a lot of times when I take a history and someone says, well, my grandfather had, you know, liver cancer, for instance, the question is, was it primarily in the liver or was it from somewhere else and spread to the liver? And so that's what metastasize means. like you mentioned earlier, you alluded to this, there's certain words that doctors, your voice and your face changes. And I hate to give the secret because people are going to be paranoid now.
Be looking
But
like
certain words, if people say, yeah, they said he has vents, and it's like, you know, because that usually means the cancer spreads. When we're talking about the lymph nodes,
wait,
that's
say
what
that
I
again.
meant.
Wait, what did you say? They usually have what? Bags, what?
When they have metastasis, it usually means that the cancer has spread
But what did you
widely.
I thought you said bags in your pipes or something like that. I'm
No.
like, wait, what? Okay.
No, so when I was talking about the lymph nodes, that's what I was talking about. So the lymph node is that hub, and then that, you know, it kind of keeps it in control to an extent. And then if it goes past the lymph nodes, now it's spreading throughout the body. And that's why if they find it in the lymph nodes, depending on the type of cancer, because that varies, they can sometimes, you know, get rid of it more easily, for lack of a better term, if it's in the lymph nodes and not elsewhere. But if it's in the lymph nodes, they're also more concerned about it metastasizing. So that's what that means. So they will talk about, medically, we'll say, you know, stomach cancer with metastasis to the liver, you know, so that means that it's primarily a stomach cancer, but it's now in the liver. So when they test for that, when they do those biopsies, they can tell the type of cancer it is and whether it should have originated in the liver or not. So that's how they figure out if it's Mets or not, is by those types of tests and things. So it can get really complicated because different cancers go to different areas. And so there's always that to consider. So, but yeah, that's what metastasize means.
Okay, I got two more. Okay, so
okay, sure.
When you deal with the is metastasis a word? I'm gonna have to check into that. Yeah,
metastasis, we say metastasis, metastasize is the action of it, and then metastasis.
Okay. All right, because y'all know I'll make up a word quick.
It's a weird word.
Okay, so when cancer patients are diagnosed with a certain type of cancer, and it metastasized throughout the body, that's where it was first. Is that where it was first located? And that's why. Okay, and that's where it started, and then the metastasis is in another area, usually another organ. Okay, and here's another good one. With the lymph nodes, I was almost putting them together when I was first asking. With the lymph nodes, and the lymph nodes, they probably have a medical background too. With the lymph nodes rotating throughout the body, like you said, the hub. Mm-hmm. If you have breast cancer and a lymph node is under the arm, is it possible for that lymph node to carry cancer cells to other parts of the body? And can it be spread through the lymph nodes? Well, essentially, in a nutshell, yes. That's basically how it travels, is it gets into the lymph nodes, and the lymph nodes overwhelmed, and then it gets spread around the body. So all the parts of our body, just to make it like a more overview, a zoomed out view, is all of our body communicates with the rest of our body in different ways. So there's hormones, there's all these things going through the bloodstream in different ways, you know, nerve signals, all that stuff is going on all the time. And so the lymph nodes can do communicate and can spread cancer from one area to the next. So once it's in the lymph nodes, there is an alarm, that red flag that goes up to a physician that's like, oh, if this is in the lymph nodes, it can be elsewhere. Now, for different cancers, the risk is different. So for some cancers, there might be more likelihood for it to go elsewhere. And for some cancers, it might be, oh, we found it in the lymph nodes, we're okay. But it just depends on, and that's when you get into oncology and all of the nuances of that. But oncology is the doctor that treats patients with cancer. So yes, it can definitely spread. All right, the benefit of early detection. Mm-hmm. Tell me about it, or tell us. Okay. All right. So yes, so like we were saying earlier, you know, being vigilant, checking your breasts monthly if you can, paying attention to any new symptoms, knowing your body in the sense of understanding when you don't feel well. And that's like a loaded thing because there's a lot that goes into that. But any new change, anything where you're just like, I just don't feel right, your body typically will tell you. And so it's important to go and have that checked out sooner rather than later. And I know this from personal experience. We tend to think the worst from the beginning. So if we have a lump or we think we have something going on, we are really wanting not to
talk about that or have it checked out, because it's like, well, what about this and then this and then this and then this? But more often than not, if you do get there and you do go through everything and they say you have cancer, there's different levels, so cancer usually has multiple stages and different, times having to do with how severe it is or how far it's spread. But without getting into all of that, there's a lot of times, the most common breast cancer is something called ductal carcinoma in situ, which is this long, obnoxious, I always say medical terms are obnoxious, this long, obnoxious term for breast cancer in the ducts, in the mammary ducts. So inside the breast, you have those ducts that lead to the nipple that send out the, breast milk and all of that. And the cells in the lining of that get cancer. Well, if it's in that duct, it's kind of like the lymph node. It's not spread yet. If they find it within the duct, then it's good. If it goes outside the duct, then it's starting to spread within the breast. And then eventually it goes to the lymph node. So if you catch it when it hasn't gone beyond the breast, it hasn't gone to the lymph nodes, the chances of survival are much higher. There's a statistic that if you catch it while it's still ductal and you get it taken care of quickly, then there's like a 99% survival rate for that, versus once it starts to spread, the survival rate goes down significantly. So it's important to find it early and get the treatment that you need.
Okay. I don't know. We had Nick who had a question. I don't know if she can hear me. Can you hear me, Nick?
I can hear you just fine now. I had to get the Bluetooth. Listen, I can hear you on speaker.
We live. We got to talk about it later.
I've been there. I've been there.
All right. Did you have any questions for Dr. Mila?
I kept catching half of what she was talking about. So, but
and she's top heavy. She's top heavy. So sometimes with top heavy women, it's hard for them to find a lump. Is that correct?
Yes.
Yeah. It's not as bad as it used to be, but I really have to. My last, which hasn't been that long ago, my last, whatchamacallit?
Breast exam?
Yes, breast exam. It was good. Because I have a lot of scarring tissue from having a reduction, I had to go back twice and they really have to search. But I'm glad I had the breast reduction, but in a way it's kind of hard because now it's a scare because of the scar tissue. But I have a history of breast cancer in my family. My cousin left here from breast cancer, which eventually spread to her brain, and she actually had 80 tumors in her brain.
Yeah.
And it stemmed from the breast cancer. So
now
you could tell.
We talked about that. Now that's different, because I would just think like, just the parts of the body, where it's located, your trunk area. So when she said, and it metastasized to the brain, how, in lay terms, help me to understand mentally how that can occur.
It's that lymph node track, so, and it varies per cancer. Every cancer can spread to different areas. So there's multiple areas they tend to spread to. So oncologists are good at knowing, like, if it's in this area, it could have come from this other area. But what they do is they'll biopsy that tumor. Like, say if they find the tumor in the brain first, which sometimes happens because that's another symptom of metastasis. This is what makes it so complicated. That person may present with actual brain symptoms, meaning they're speaking louder, depends on what part of the brain it's on. It may be speaking louder, having a hard time hearing. They might have shaking. They might have hallucinations. I mean, there's all kinds of ways this can appear when it's in the brain, because now it's affecting them, their thought and their function, their mental capacity. So even though they have a primary breast cancer, it's gotten to the point where it's gone all over. So they can spread far. Some of the most common places for metastasis, just over an overview, is breast, liver. Breast and liver is probably the most common. They typically don't spread to like the heart. Sometimes the lungs can be a big one too. So it just depends on what's going on. Like I said, what they do is, if that's where it presents, so somebody might have a certain type of tumor that spreads to their lungs and they don't present with that, they come in. And when I say present, I mean when they do come to the doctor, they're having trouble breathing, they're coughing up blood, things like that. And they find this tumor in the lung, and then they have to biopsy that, and then they find out that it's a different type of tissue than what's normally in the lung, and then they say, oh, this is probably from the colon or from somewhere else. So they can pretty much spread anywhere, but there are certain tissues that certain types of cancer go to.
All right. Thank you so much for coming on,
Yeah,
Dr.
absolutely.
Kamilah Williams. For those who are just tuning in, I'm going to give this number one more time, 619-902-2287 for the viewers and the callers and the texters that called in. Thank you for your questions. We always love them. We want to hear what you have to say. Our guest today is the host of Pivot and Bloom and the Single Well. How can we hear you on those platforms?
Yeah, so I'm very active on social media. Clubhouse is my absolute favorite place. So if you go on Clubhouse, you can find me. And I am at the Christian Wellness Doc on Instagram. So I post a lot there. I have a page for the Single Well as well. It's just at the Single Well spelled out. And then if you're looking for the podcast, which I see you've updated yours recently, Mel, the different podcast platforms. So like Spotify, Apple Podcasts, Google Podcasts, any of those places, if you look up usually my name or the Single Well or even Pivot and Bloom, it should come up for you. And you can listen there. A lot of people have trouble with podcasts. It's like, well, where do I listen? When is it? Is it a show? What is it? And so we have these podcast platforms that you can go to and just download stuff. You don't even have to download it, just listen to different topics. And I highly recommend that, because when people are speaking on these free platforms, you can get a lot of free information. So podcasting is a great way to do that. Not just my podcast, but all the different varying things out there. A lot of the stuff we talked about today is somewhere on a podcast. There's a lot of doctors and health professionals starting to speak out. So if you do nothing else, at least start to get information that way. There's a lot to be learned there. So I'm on all of those, anywhere you can listen to podcasts, essentially. You can ask Alexa to play it, Siri will play it for you. So really easy to get to do that. Just hit the button for Siri and say, play Pivot and Bloom podcast or play Single Well podcast, and it should come up.
Awesome. You know what? I decided to put that out there because I would say, like, on your favorite podcast, you can, and it was, you know, you do have those questions of, well, where do I find it? I was like, any podcast. So I decided, let me write it.
Yeah, you have to be specific.
Let me write it on all streaming platforms and make it easier.
Yes.
So wherever you like to go, just go. And that's how it is with Shop Talk with Mel. I thank you again for coming on the show.
Yeah, you're welcome. It's fun.
Like we love you. A wealth of information.
Thank you. Love you too.
That is Dr. Kamilah Williams, and you can find her on Facebook, Pivot and Bloom, and then the Single Well, WELL. Look, the traditional way, single. Spelled traditionally. We got to put that out there.
Yes, because people do have to shift. Yeah.
Right. It's like, okay, wait, is the single with a Y? No.
Yeah, exactly.
Traditionally spelled,
Yes.
you know, just straight, plain, nothing extra fancy. And she speaks truth, and it's direct. And you guys know, you know, from her even being here, you can ask her the questions and she'll give you her answers. All right, Dr. Mimi, thank you for coming on. I truly appreciate you.
Yeah, it was fun. Thank you for having me.
Always a pleasure. Okay, and if you guys have questions for her later, y'all know how to do it. Hit your girl up, hit me up.
Yeah,
and
I'll check back on the comments too and make sure if there's anything I can answer.
Awesome, thank you. Let's give her a round of applause. Crack myself up.
Thank you.
All right. Okay, Nick.
Hey.
What's up? Let's get with these hot topics, girl. You was trying to do it all day. Trying to make it happen.
Yes. Either I could hear you, but I couldn't get on, or the opposite way.
I know, it's so weird. That was so weird. And I'm like, okay, restart your computer. You know, you gotta do all that stuff now because everybody's streaming. Everybody live.
I did it 50 million times and still. Either I heard you or I couldn't come on, or I can come on and couldn't hear you. And I'm like,
one or the other.
Yeah. Can I get both today? Like, what's going on? But yes, them hot topics, girl. Listen.
Yes. Since speaking of streaming, you know, Netflix is making money now.
Yes,
And
they are.
and
Especially
last
off of Dave Chappelle.
listen. And oh, I like your cup.
Yes, you see that, people? For those of you that can see, Shop Talk with Mel.
Hey, that's
Made
from
by
Bella.
Shonda Lewis.
Yeah, well, no, Bella Crafty Creations.
Oh, okay.
It's
Yes,
made by
Bella
Bella
Crafty
Crafty
Creation.
Creations. Yes. All right. Speaking of Dave Chappelle, I want to run it back real quick. I want to give you the response that Netflix had, because if you didn't know, I'll like catch you up. Okay, so Netflix, you had some transgenders that were saying that they were going to walk out on Netflix, the employees, if they didn't remove the platform. And again, if you watched it, it's just hard. It's hard for me to understand people who make a decision and they haven't watched it. Or, you know,
Right, because
snippets
somebody
and you go with that. So anyway, there were employees that were talking about walking out of Netflix, transgenders walking out of Netflix if they didn't pull it down. Well, Netflix, they gave a response. And their response was, I'm paraphrasing because I'm not reading it, but they said they respect the decisions of the employees who choose to walk out.
Boom.
I'm waiting on your boom. I was waiting on it, so it was like, and I don't want to talk over you because it, you know, it'll cut you out. But yes, how about that? Netflix like, okay, bye.
Hey, exactly.
And
exactly, because they don't speak for all of the transgender community, all of the gay. You know, some of them had a fit. Some of them, I've read comments from a lot of transgenders, gays, lesbians, said they didn't find a problem with it. He was funny. Like they didn't, it wasn't offensive to them.
And it was more so to me respecting them. And he was talking about his friend, transgender friend, Daphne, you know, and I felt like that special was for her.
Right.
Gas prices in California, I want to say it was like Gonda or something like that. It's about $7.59 a gallon in California. Now, I don't know if this is true or not. Let me put that out there.
It might be.
I don't know if it's true or not, but I remember how the gas was before for $7. I saw some guy filling up all these gas cans at the gas station. I mean, it was a lot. Putting it in the back. I figure he had a farm. He probably like, let me get ready for whatever is getting ready to happen.
Mm-hmm.
Oh, you know what? Let me say this first. This is important. There's a recall. If you are anything like me and you like room sprays and the aroma and all that lovely stuff, there's a recall on the room spray, Better Homes and Garden, the aromatherapy. And I know they sell it at Better Homes and Gardens. I know they sell that at Walmart. So there's a recall on it, and it's supposed to be dangerous and unhealthy for the body. So if you have anything aromatherapy from Better Homes and Garden, you want to go ahead and check out that recall and not let it smell up your room, because you might be inhaling some dangerous fumes or dangerous toxins. Let's put it that way.
Have you noticed that since time has gone on and progressed, and the things that we used back, our parents used back when we were younger, and things that we ate, all of a sudden now, you know, with technology expanding and things like that, there's more recalls on stuff like that, and just food, you know, and just, we didn't have that problem when we were younger. When we were kids, we didn't have that problem. I don't remember any of this going on. I don't.
Interesting. Very interesting. And you are right, because let me tell you what I did. It was a gnat, you know, the fruit flies. Some call them fruit flies, we call them gnats. That was just like flying around. I went throwback, put some alcohol in the spray bottle. All you gotta do is spray it in the area. It was over. Done. I was like, oh yeah, so I feel you, Nick. Time to take it on back. And there's a lot of people that are starting their own gardens, you know, those above the ground gardens and all that other stuff. People are like putting their own stuff. Some people plant their little stuff right in their window, inside the house. So I thought that that was interesting, but great point. Now, tell me this. Dr. Dre was served divorce papers at his grandmother's funeral at the at the cemetery. Now, how would you feel if you were served divorce papers at a funeral? What's your thoughts on that?
Get your bail right now, because sorry y'all, but this is just Nick being Nick. I'm whooping everybody's ass. Period.
What's your thoughts, Rugo?
Move over, Grandma. You're gonna have some company in that coffin.
Thank you.
No, but I mean, hey, I know the thing is, think about like from that person's perspective, it was probably impossible for them to serve him those papers. And any other, think about that. To catch up with Dr. Dre, that would have been impossible.
No,
to be like,
not impossible. If that was your husband, if that was your spouse, and you know your spouse's every move, you know they schedule because you were married to them long enough, then it's not impossible. You know when they're staying still. That's when you get them. But right there, that was not the time or the place. She was wrong. She needed her behind whooped, and whoever served them papers need to have their butt whooped too. Sorry.
The people had a job. They had a job to do.
That's a job. They had to get it done.
Getting their butt whooped for doing their job at a funeral.
Well, I did just
had an aneurysm. He ain't gonna fight. He just about the aneurysm.
I would have sworn. I would have sworn.
Go ahead, Rugo. What'd you say?
No, I mean, I'm saying I understand those people had a job to do. I can't, I mean, at no time is it good to be served with papers. There's no good time for it. Even if you gave me a piece of cake, it's a bad time. You know what I'm saying? Like, here's a piece of cake, and you've been served twice. Right. White cake and lawsuit.
Regardless, there's a time and a place. Yes, you have a job, but have some respect, some kind of coof. There's a time and a place, and a funeral is not the time nor the place at all.
Okay,
well,
at all.
I think though we need to look at, like, I would want that person to write us a book on what they had to do, like how many times they've been trying to serve this paper. I would like to hear that part of it, because I'm sure there's been people like, oh no, he's not available, and he might be right there making beats or listening to him, listening to beats, I guess. I want to hear that journey to be able to say, this is my last ditch effort to get it done.
And that's what I'm thinking. It probably was the last resort. I remember somebody was trying to serve someone else, and they thought I was the person, and they tried to like put it in my hand. And I sat there, I was like, it hit the floor. You're not serving me because I'm the wrong person. I said, I'm not that person, and walked right on in. You know what I mean? And so you have those people that are doing a job. And I felt, when I looked at it, I said, okay, she probably tried every other way and he avoided it. And I know he's going to be here. Don't go. She probably did say, don't go into church. Just at the site, the grave site, just go ahead and serve them. So these are like mixed messages. And yeah, he got served his papers at his grandmother's, the grave site of his grandmother's funeral. You said no.
Guess what?
But where's
my first husband? I served myself because I knew he was going to be hard to catch. Give me them papers. I got this.
But is that legal?
At a club. Yeah. My attorney gave it to me. I said, I know how to catch him.
And they said, here, no, I'm like, you got to get your own job. You got to get your own.
Nah, he gave him. I told him because I knew that man well enough to know they weren't going to catch him. He was going to refuse. He wasn't going. So guess what? I got this. I tried to. Now this is where it got ignorant, and now it's his fault because I saw him at a club. I need to talk to you, and he, we ain't got nothing to talk about. You up here in town visiting with you because I was, living away.
But see, that went all different type of ways. I don't think there's nothing wrong with it. I don't think it should, there probably is no respect. Let me put it that way. Like, I don't respect you. So she didn't feel like she clearly needed to respect him. That person just did their job. But we got to hurry up and move on to the this other part. And I know it's going to take some time. Let me talk about the In-N-Out Burger. You know about In-N-Out Burger? You don't know that restaurant?
I know the restaurant, but I don't know what you're about to say. I've never been there before.
Okay, it's out west. That's why I know it. But In-N-Out Burger, they are closing, and they are closing because in San Francisco, they have the law, obviously, that says that that everybody that comes there has to be vaccinated. And they refused. And the guy, he just was like, close it down. Because to my understanding of this, for them to come in, they have to be vaccinated in California as well, like the customers. So he was letting people in, like it's, and the reason I brought this up, because she was talking about the club, like you got to be carded to get into a fast food restaurant now. So
well,
A lot
not
of these
know,
places are going to start losing money.
you know, not knowing the layout of these places, I would, you know, because I take for granted that in the great state of Ohio, Youngstown, Ohio, we have a lot of drive-throughs, and in other places they don't even know what that is because they don't have the room to let people like drive around and drive through a building or whatever. But I wonder, like why not just go through the drive-through? Why not have like, why not just cut why not just cut a hole in the wall and have
make a
people walk up
drive-through?
there? You know,
Oh,
people
like
just
the
walk up.
rallies.
Yeah, why not do that?
They could possibly do that, but then it would cost them more money. But you know, did you work in a fast food restaurant before?
I did. I worked in 2 of them.
Okay, did you, Nick?
Mm-hmm.
So you know, when you be like dine in, dine out, there's certain taxes. So I guess he figured, like, if they do have the option of the drive-through, I didn't even check to see that. It's like, okay, well, I'm losing money. And
Not really up your taxes on the dine out.
that ain't right. You can't. That's illegal.
Well, like some people was trying to do that
Well, they'll
COVID
raise the
surcharge.
prices of your food.
Yes, you
Yeah.
remember that? Like that COVID surcharge. Wasn't that nuts? That's illegal.
I mean, I don't know if he's cutting off his nose to spite his face, but if it was me and I was kind of concerned, because right now there's many fast food restaurants, and even our part in our part of the country where they may not be closed, but the lobby's closed. You can't go inside anyway. Now I think that's due to a lack of workers. So I mean, like, if you know, shut the door, cut a hole in the wall, and sell your burger.
Like Nick, yeah, okay. But here's my thing. This is what I'm thinking. Him closing them all, the person that it hurts is his employees. Because he probably has the money, because there's a lot of people that have the money. It's like, okay, I'm just keeping this open for this. And if you don't have, like you said, if you don't have the workers, you know, you don't have to worry about that either, but it's hurting the workers that are there, I would think. And he's like, okay, well, bye. This is what you're telling me to do, that, okay, you're wearing a mask. And to me, it's like, go in at your own risk.
Is he going to move the franchise?
It doesn't seem like he's just shutting them down.
Well, my thoughts
it's funny because people like him, like you said, making money, gonna make a lot of families suffer now because of employees losing their job. But he's one of the main ones that call in and cry because he's not eligible for a $25,000 grant. Like I said, I see him all on my job.
Okay, go ahead, Rugal. What were you thinking?
So what I was going to say was the other positive thing about it is that those businesses because usually if you have a fast food restaurant, there's somebody either on the opposite corner competing with you. You know, so if you got a Burger King, there's usually McDonald's or whatever, right? So I mean, like when you really think about fast food and it being a real estate game at heart. You know, there's an opportunity for another business to be able to grow. Matter of fact, those workers may come back and try to get that property and open they own burger spot. You know what I mean?
Right.
You know, so I mean, there could be opportunity that he's leaving that he's creating through leaving, or at least you know, if that's no longer an option, you're gonna go to XYZ place to get something versus, you know, that. So I mean, you know, as people make these decisions, the world still goes round.
Now that's true. Now, you know what I was thinking for him, you know, you got to know when to hold them and know when to fold them, know when to be in and know when to be out. No pun intended, the name of the In-N-Out Burger. You know what I mean? But if he feels like his finances are there, you know, now, like before I lose and I still have to pay my employees to work, let me just go ahead and be done. And, you know, and it's sad, but let's be real, in business, are you really thinking about the little person? And I'm not talking about the mom and pop, not the mom and pop spots. I'm talking about on a larger scale. Are you really thinking about the employees? And I'm gonna say this, I don't think so, because remember, we were talking about a few years back, the minimum wage going up. Minimum wage can go up until now they don't have workers. So clearly you had the finances to do so. Go ahead, Nick. Nick had something. Go ahead.
Okay.
My thing is, if he's not thinking about his employees, or he say, okay, fine, close it, guess what? Now you're having to pay the employees to not work because they're able to file unemployment now.
Not if you close down. Well, but if you close down, you out the game. Versus
but if he's
termination.
closing down for a reason, like because he just wants to, because he wants everybody to come in there that's being patronized and to be vaccinated. That's not fair. That's unconstitutional, and that's
not him.
Work in
that's not him that's saying that. The government is saying
the
that.
government.
It's not him, and he's like, I'm losing money. It's the government that's saying your people aren't vaccinated, so, and they refuse that, and he's like, no.
Well, yeah, it looks like it had, like I looked at an article by The Guardian about it, and it looks like it's only in San Francisco, and it was the health department there that has the requirement to, I guess, to check if people are vaccinated, I guess. But I think the way
are they fined? Isn't he being fined if they're not vaccinated or something nutty like that?
I guess if they're going to try to, if they're going to enforce it, I guess that would be the issue.
Or they were going to shut them down, and he just said, bye, shut all of them down.
It says here that the majority of In-N-Out's other locations are in Texas, Southern California, and Utah, where there are no statewide mandates for restaurant customers. However, its branch in the city of Los Angeles, where a vaccination mandate for restaurant customers is expected to be signed into law by Mayor Eric Grassetti next month. So I guess he has an issue with what's going on in that city.
Yeah.
Yeah.
That's interesting. All right, let's talk about Alec Baldwin, the incident. Yeah, rest in peace, Mrs. Rust. The incident where they were shooting the film and he pulled the gun and the gun shot her in the chest. Now they're trying to say it was shrapnel or something like that, but I believe it was a bullet, the prop gun. It was a Western movie, a Western film being done. And he picked up the gun and bam, there it is. Now, like I said, I want to say alleged shrapnel, alleged bullet. I believe it was a bullet, and they probably don't want to say that. And then it hit the other person that was around, and they recovered, but the young lady did not. Now, my thoughts are a bullet, it went through her chest and hit him. Yeah. So, you know, and just reading it, and I don't know who's the victim, because, you know, even though we know that the one that passed away is the victim, but even Alec Baldwin being the victim, he was sick. Did you see the photos of him after?
Isn't that what happened to Brandon Lee?
Yes.
Yes.
Bruce Lee, sorry, yes. But, and see, speaking of that, Nick, they were supposed to have put things in place where this wasn't to occur again.
Yeah, it's happened over. This is the third time it's happened in the film industry, at least in America. She was a cinematographer. Her name was I think it's Helena Hutchins.
Rust, R-U-S-T was
that's the name of the movie that they were
was
working
Rust.
on.
That's it. That's it. Helena Hutchins. I know she had a child or maybe children and her husband, and Alec Baldwin reached out to her husband, and I'm sure, you know, just remorseful. Can you just imagine that? Now, you know, it's a backstory to this, right? Let me fill you in. Now, she was the cinematographer. And I'm thinking, if she wasn't even an actor or actress, how? So those are up in the air. And let me say this is all alleged. I have to put this out here. This is all alleged, but here's the backstory. The union for like the production team, I want to say 3 days before they were protesting, before this incident happened, and they walked out a few hours before this incident happened, because they were talking about how there was no hotels there. They had to work long hours, you know, close to them. They had to drive like an hour away. It's a little more to this story, which makes me think, because y'all know my wheels get to turning, did somebody deliberately put a bullet in there?
You
know what I mean? And it falls on Alec Baldwin, who, you know what I mean? You think, because our actress and actors, we've been there. You there, you get there, you have your stuff. You guys know, like the props that you use. You just pick up your props, you think all is well, correct?
And keep going, right.
You know what I mean? And you just
don't check it.
Because and in television and in film, it's a whole production that handles all that prior to. You're the talent.
Exactly.
So you go
exactly. It is not your job to check any of that. It's your job to get on there, get your prop, and get to where you got to go and do your lines. That's it. That's all. Everybody else behind the scenes is working production and everything else. That is their job, to make sure things are working, things are in place, you know, making sure that the production runs smoothly. So I agree with you. This sounds like a setup. Somebody deliberately put a bullet in there. I don't care what nobody says. That's what it sounds like to me, because that's production's job to make sure things are run smoothly.
Well, they're not necessarily calling it a bullet per se.
I said that at the beginning.
Yeah,
go ahead.
Okay, because I'm reading an article on it, and they were basically saying, okay, Baldwin removed the gun from his holster once without incident, but the second time he did, ammunition flew towards the trio around the monitor. The projectile whizzed by the camera operator, but penetrated Hutchins near her shoulder, then continued through to Sousa, who was he's the director.
So you telling me, have you ever heard of shrapnel going through somebody and hitting somebody else? I'm just saying.
It depends on where it hit her at. Because if you, I mean, it's horrible. But I read some of this stuff and they were talking about how when these bullets are made, that really they hope that nothing comes out, but sometimes there are like plastic or even paper that can pierce somebody. So we're talking about deaths, but there's probably people who's been like actually injured from this happening. You know.
Excuse me. You said two keywords here. You said two keywords: ammunition and projectile, aka bullet.
Well, I think in this
is all alleged, but here's the thing. Watch this. I want to say 6 days. Don't quote me on it, okay? Like I said, this is alleged. 6 days prior to that, because I read like 5 or 6 different articles. You know, sit there like, let me see, let me look, because I'm like Inspector Gadget out in this mother. 6 days prior, still keeping your head about the whole production team. They're protesting. Those are people that do everything. They protested. But 6 days later, I guess, alleged, air quotes, I'm using for a listening audience, they were talking about the gun had did some funny stuff 6 days prior. Then, right, so they were saying, hey, this needs fixed or whatever, it's all alleged, and nobody did anything. Now, according to the union, they were working against their union contract. So everything that they were doing was not in their contract. So that's why they were protesting. Okay, wait. Then hours before this happened, that occurs. I just feel like it's a little, I don't know.
I'm not gonna go down that rabbit hole with y'all. But what I will say on here, what the rest it says late Friday, the Associated Press reported that Baldwin was handling a loaded weapon was handed a loaded weapon by the assistant director, who indicated it was safe to use in the moment before the actor fired it. According to the court record, the assistant director did not know the prop gun was loaded with a live round, according to a search warrant filed in Santa Fe court. But it goes on to read, the person in charge of overseeing the gun prop, known as the armorer, Hannah Gutierrez Reed, could not be reached for comment. The 24-year-old is the daughter of veteran armorer Theo Reed, and has recently completed her first film as a head armorer for the movie The Old Way with Clint Howard and Nicolas Cage. So she was kind of new.
Live round bullet.
Go ahead. What did you gather from that?
Well, I just, okay. Have y'all ever, okay, I'm hoping that it's an accident. I don't think that the rabbit hole goes as deep as what y'all say. I don't even think it's a hole at all, you know. But I look at it and I say, have you ever okay, I remember as a kid, you know, you used to get those pop guns, you know, like you put the thing in there, pop, and it was like, it would like this stuff, you would pop it in the back, but it would kind of fly out or whatever, you get hit with that. But I also ran track too. And I remember like when they would fire the gun, sometimes you could like, it depending on how close you were to the person, I remember getting feeling like, oh, what was that? Like I got hit with a little something from the pistol. But I just, I don't know. I don't think it was done intentionally, but the thing is that these are weapons, you know, and it doesn't seem like he was doing it. He did something in a malice way. It wasn't like he was like, hey, let me, like I'm saying, I don't believe from what I've read that Mr. Baldwin was like, hey, let me play around with this gun, and you know,
that's not what we're saying.
Yeah, I know you're not saying that. I didn't say you said that.
Hours before did something.
Yeah, I'm not saying you said that. But I guess what I'm saying is that I just don't think the intention was there, especially tied to the union matter, that would happen. If anything, this would work against them.
Well, yeah, but who gonna come out and say they did it? Like, nobody gonna say that because they'll be charged with that death.
Well, I don't know that if they charge people with debt with it as, I mean, I don't know. Once the investigation rules it out. Huh?
Have I been watching too many Lifetime movies?
True TV.
I mean,
Court TV.
There could be something deeper.
I Got Away with Murder.
But I just kind of
2020. I'll be watching them.
I just kind of feel like in this situation, what is the likelihood of knowing that, okay, he's going to take this shot towards the camera or whatever, and this is going to happen? Like, that seems like a extremely elaborate supervillain plan to ensure that you get this one person through that effort.
You know, I don't think that.
I Got Away with Murder. Have you ever watched that?
No, I have never watched How to Get Away with Murder.
Let me say this. I don't think that it was deliberate to kill somebody. But if you told the people, let's look at it this way. If you told your people that, hey, this is what's going on. We're working short, long hours, 6 days prior. And I'm just saying, I read six days prior, we had issues with this. Nobody addresses it and be like, oh, okay, well, let's see what happened this time. I don't think no one was, I think it was supposed to be I don't think, and I'm praying that nobody intentionally wanted to kill somebody. I still believe it was a bullet going through, like, get out of here. And I understand what you're saying, Rubo. But it's a weapon. And I'm thinking the way that, you know, like Nick's talking about with all this new and improved stuff, we're talking about prior to you coming on, with all these new electronics and all these new additives that they have, wouldn't by now you have something that'll show like it's a gun? You know what I mean? Like with all the antics and the computer and you know, all the little media stuff, a cinematographer. Let me make this look like a fire and make the gun sound. Come on. I think that, like, do we even need to even use it now? And then when she brought
We have toy guns that look like real guns now. Toy guns.
remember, that's how that little boy in Cleveland got killed by the police. Remember, it was a toy gun and he was at the park. Can't think of his name right now. So many.
Tamar, wasn't that Tamar Rice?
Rice. I was gonna say that, Tamir Rice, but I'm like forgetting, you know, the situations that it occurred. But yes, so I'm thinking, why would you even have to have that type of gun on set? It's tragic. It's unfortunate. If it was intentional, I'm sure that person's gonna take that to their grave. And they did it at the expense of the actor, the victim, and the other victim. And, you know, the deceased, what's her name, Helena? What's her?
Yeah, Helena Hutchinson.
Yeah, her,
I mean, Hutchins, no.
But a lot of people don't believe that, you know, when you're working behind the scene, that there's no danger, but there is. And there is, you have the Actors Guild union, you got, it's so many different things that take place, and in production, it's a lot of people that work together in production. And I'm still stuck on the same thing. You have your production team, they make it happen, and you have your talent. And it is not the talent's responsibility to make sure that all those things are done. You know what I mean? That's what they're being paid for. And then they walk out hours before. So this is a little deeper. You ain't going down the rabbit hole with us, but me and Nick, that hole is deep. And you walk out hours before, so you guys are going on with production, and this occurs.
Yeah, there's a real
suspect.
There's a real interesting article on this at the New York Times. It's called striving for authenticity. Films often use real yeah, there you go. Sorry.
Okay.
Thank you. Authenticity. Films often use real guns on set. So they go into, I'm not gonna read the whole article, but it's very interesting. I think if people want to know more about it, it gives some really good insight on what should be done to protect people. Okay. So yeah.
Okay, that's the New York Times. All right, Colin Powell.
Yeah.
Rest in peace. I had some viewers and some listeners that actually contacted me, and I want to talk about it real quick. He was vaccinated, and they said he passed from underlying conditions. Now, I'm gonna put this on.
He had cancer.
Listen, I'm just saying what the people saying. Okay. And that's cancer is an underlying condition.
Yeah.
If that's it, but I don't know. But like the articles I read, and they were saying, you know, are skeptics on the vaccine. Okay, so let me put that out there. Clearly, this message was from. It was a question. I don't know if they're a skeptic or not, but the question was. Well, let me put this out here. She does not believe Dr. Fauci anymore. She said she was with Meghan McCain on The View. She shared that on The View one time. Meghan McCain said she does not trust Dr. Fauci. Okay, so you guys got to check that out. And this is alleged, but I did see that episode. I don't know exactly the words, so I'm paraphrasing. But here's where the issue is, or the question. When you get the vaccine, okay, get the vaccine. If you have underlying conditions, get the vaccine, you'll be protected. Then you have people who are vaccinated and they say they died because they had underlying issues. Make it make sense, in quotation. You want to respond or no?
I want to clarify. I want to clarify something that I said earlier. Says General Colin L. Powell, former U.S. Secretary of State and Chairman of the Joint Chiefs of Staff, had passed away this morning due to a complication of COVID-19. The Powell family wrote on Facebook, noting he was fully vaccinated, but he did have cancer though too. I think the thing is we had taken into account too that Mr. Powell was 84 years old. He didn't seem like he was 84, but he was an older gentleman, and he had a serious health condition.
Okay. I hear you with 84. I'm not trying to be funny, but 84 is like the new 64. Let's take into consideration. And Nick, I want your view on that, listeners. Okay, comment that they said. But Rugal, your grandmother, how old was she?
The one that passed, or one that's still alive?
The one that passed away.
She was 90.
And was like what, 69? If you looked at her and how she was moving about.
I mean, she was definitely, I feel younger.
I would have never thought in a million years.
Yeah, I'll give her 80. You know what I mean? Okay. I knocked 10 off of there. You know what I mean? She had some conditions that were more like she succumbed to or diabetes or what have you, or effects of diabetes, I should say. But ultimately, though, I mean, most of her major issues were her mobility.
Okay, let me say this,
like,
and this is why I wanted to bring her up. You have a physician that goes into, say they go into the ER, and they look at her age, and that's why I'm using her, because I know she looked good. You look at a 90 and you're saying, well, let's take into account he was 84. Does that mean that there's no quality of life? It's like, okay, just pretty much let it go? Or, you know, like, you know what I mean? Because you look at, and the reason, like I said, like your grandmother, 90. You could have never told me she was 90 years old, but then you have a doctor, and I'm not saying all doctors do this, but you have people pretty much say, and it bothers me when they say, oh, okay, well, they're this age, so like they're supposed to go ahead and go.
Yeah, well, I'm not implying that they should go, because you know, with my grandmother's situation, I mean, I was really fighting to convince her to have what needed to be done earlier on, which she was not, which she didn't want to do.
Okay, but so she wanted her own terms. That's
but to go back to Mr. Powell's, I mean, General Powell's situation, you know, it says here General Powell had multiple myeloma, a cancer of plasma cells that suppresses the body's immune system response. You know, as well as Parkinson's. So he had a lot going on.
Parkinson's, you know, knowing, you know, looking at it, but pre-existing illnesses. So when, you know, that's what I'm talking about. Nick, do you remember the question?
Yeah, and I already said I agree with her 100% when she said. I mean, there's too many people who have taken this vaccine that haven't had any underlying conditions that all of a sudden passed away after they took the vaccine. And get out of here. And anytime the government is pushing something, first of all, you're not supposed to be pushing. Stay out of health issues. Period.
Well, that's not. Go ahead.
But anytime you have the government pushing something so hard that they were willing to pay you when they was doing that $1 million lottery, something ain't right with that. I don't care what nobody say. I don't care what nobody say. I don't care what nobody say.
Wait, but we got to stay on with the comment that was made, and the comment. And I thought it was a good point that was made.
Yes.
And you know, I can't answer that because it's always physician practicing medicine, and we're still trying to find out. We're still learning. So I have to definitely speak on that. Just put, you know, you guys, you know, can follow the CDC, can follow Dr. Fauci. Those options are out there. Google it yourself. Like I said, you know, you got your Google MDs out there. We were talking about earlier in the show when we had Dr. Kamilah on. But I wanted to share what she said, and it is confusing. It's totally confusing when you say, get the vaccine. If you have underlying conditions, you're first on the list to get the vaccine. So, and then that changed. And if you go back, it just said, you'll be fine. So you're thinking it's preventative. And then it has changed over the months where it says you won't get it as bad. And then it was, you won't die. But then you have people who actually passed and they say the exact same words because they had died, you know, dead from COVID. from underlying issues. So you're saying the exact same thing. But what you have to do, you have to learn it for yourself, read for yourself, and make your own decision, and don't feel coerced. That's my point. Now let me get on to the hot topic. Your boy Trump. Did you hear what he said about Colin Powell? Rugo, you got to unmute. Rugo, you there? There you go.
Yeah, I didn't hear it, but I know he said something bad about him or something.
Yeah, and I'm not going to repeat it, so you guys check it out. But your boy, he's just doing him. He's doing him. And just
I wish somebody would do him.
But he called him.
I wish somebody would do him.
A rhino. He called him a rhino. And what rhino means is, go ahead, Rugo, you do your thing, politics. Go ahead.
Republican in name only.
Okay.
And and his main issue with him was that basically Colin Powell felt that he should not, that Donald Trump was unfit to be president.
Thank you. He very unfit. Somebody need to do him and call him 6 feet under. How about that?
No, bind the devil. Loose here, saying in the name of Jesus, we do not condone violence here. And or Shop Talk with Mel. I have to say that, okay? And the views of the host and wait, I got to do my part. Wait, you trying to get me off? The views of the host and the co-host are not the views of everyone on Shop Talk with Mel. Go ahead, Rugo.
You know, the thing is, it's like this. It's like everyone who had a different opinion than him, when tragedy unfortunately strikes them, he has something negative to say. I mean, it's the same thing with Senator McCain. You know, he said he ain't a war hero to me because my war heroes don't get captured. Remember he said that? Yeah. And it's people who like support, who have flags that support POWs, and then sometimes I see them also supporting this guy, and I'm like, how can you live in both worlds like that? I don't understand it. But it's just more the same. He's gonna use anything that happens to anybody, he's gonna use it as a speaking point to him. You know, if at one point he showed any humility, he might have actually won the election. But it's just so weird that the whole thing that he's done. I don't know. I want to go back to the COVID thing, but he came up with. I give him credit. Operation Warp Speed. We got that vaccination. Then it was like, don't use it. Then he was telling people to drink bleach. Then he was telling people to use medications that weren't proved as solutions to the sickness. And even now it's even more propaganda. Like what they told somebody to take what was it, like, was it dog medication or something, or elephant medication? I can't remember what it was. But I took them straight out and I used my own common sense. That was I'm just saying, I don't know, but he does what he does. But I did want to bring up this point that according to the U.S. to the New York Times, as of I would say today, this was just updated 16 hours ago. There's been 45.4 million cases of COVID, 736,000 deaths. So, I mean, that's what we're facing. That's a lot of people. That's a lot of cases. That is a lot of cases. And I want Nick to talk about her hot topics, and I want you to talk about that article. Both you guys, the Media Press. But let me say this: do you think this being forced or coerced, or whatever term you choose to use, to get the COVID vaccine? Do you think that Trump is going to have a chance to get back in because he plans on running in 2024? All his supporters going to end up getting COVID. I shouldn't say that. I shouldn't say it, but if the thing is that, like, I think anything's possible. Okay. Okay. What's your thoughts, Nick?
I'm hoping that they got him in court by then. I don't know what the state of New York, what they playing around for, what's going on, but why is y'all dragging y'all feet when a common person that'll jaywalk across the street, you get them in court and get them convicted within 2 or 3 months? But it's taking y'all forever to get Trump. Get him off the street. He is a criminal, period, point blank. Y'all elected a criminal in the office to run the country. You see what he did. He started an insurrection. Now you pussyfooting around that. Get him off the street. Ooh.
Okay. All right, let's talk about this Meet the Press. It was on Meet the Press when they were talking about, you know, what we were talking about, like Colin Powell and Trump and all that. And the churches, the church, the politics. Did you see that? Rumbo, did you view it? You got your mute on.
Say, repeat that, please.
The church and the politics. Church and state.
Okay.
And where they had that church. Did you see that on Meet the Press?
No, I didn't. No, I didn't.
You didn't view it? Okay, well, we can't talk about it because then I'll talk about it by myself. Did you view it, Nick?
Child, listen. You see, I'm over here walking back and forth.
Did you see those people?
Girl, listen.
Did you view it or not?
That is a modern day cult.
Okay.
So I definitely viewed the whole thing. I agree with the last two pastors, but that one right there, that very first one,
Well,
that is a modern day cult.
Okay, for those who don't know, share what the last two pastors said.
They do not agree with combining politics. Basically, I'm going to sum it up. They don't believe with combining politics and religion. They believe that religion needs to stay religion and politics is something separate. You do not talk politics in church, period, point blank. What you supposed to be talking about is Jesus Christ, your love for Jesus Christ, about God. That's it. That's all. That's what I got from it.
Okay,
they don't believe in that.
Now let's talk about the first one who was for Trump and what he was in his congregation.
I'll put it this way. He thinks that unvaccinated people, unvaccinated people and a few other people are against God.
Unvaccinated people are against God?
And that Trump is the end all be all. He helped this country. And
the opposite.
Listen.
The opposite.
Listen, the way he was talking is basically Trump was the way it sounded like to me, the way he talked, Trump was his God. Man, by sit down, have several seats, gone somewhere with your cult-like behavior.
Okay,
you are the epitome of the devil.
Okay, so what he was saying is that the unvaccinated were called pretty much like the end all be all. So he was for the unvaccinated, the Trumps, that's what they were for. But the interesting thing, it's almost like this whole, like she was saying, like a cult, like the whole, remember Jim Jones, the whole thing. It is just so weird. And I said, it seems like people nowadays want something to be a part of. And if this is what we're doing, this is where we're gonna go. You know what I mean? This is what, okay, we're against this, the insurrection, they still feel as though that was okay, even though they had an issue with Colin Kaepernick, who peacefully protest. And by them peacefully protesting, it was like, oh, that's disrespectful to the flag. Yet you go up to the White House, the house, okay, and you use that flag that you said that Colin Kaepernick, that they called them sons of bees, called all their mothers bees, was being disrespectful, but you go and you beat people with that flag. You know what I mean? This is all too much. It's just all too much.
Modern day Sodom and Gomorrah.
Okay, now do you have any other hot topics, Nick?
Yes.
Go with it.
Miss Stephanie Mills.
Woo!
She was on I can't think of the name of the show, but it's Selena Johnson and a couple other people. But she was talking about how all of a sudden now the industry is pushing back R&B singers because the black R&B singers are black artists because they are basically how do you want to idolizing white people who are now singing R&B, like, and she brought up Adele and Justin Timberlake. And she's really, because she said it's more and more very good artists who are being pushed in the background or not even being recognized at all, or the old people there's, you know, the old people who are still in the studio trying to work, that you don't even know nothing about any of their music unless you listen to certain stations that, and you like, I didn't know that, you know, because they're pushing forward Adele, Justin Timberlake, Sam Smith, and he had something smart to say about Michael Jackson, and she went on live, whatever, on live, and put him on blast and dared him to respond. And guess what? He did not.
Okay, wait a
So,
minute.
yeah.
So Rubo, okay. So Rubo, what's your thoughts on that? Do you feel that the industry is pushing forward or putting on the platform the white R&B singers and putting them in the forefront and forgetting about the Black R&B singers?
Well, let's think about this. I mean, let's think about the music industry as a whole.
Go ahead.
You know, I mean, look, how many, this is locally, how many, urban, they call them urban channels, but how many channels are black owned or for a Black audience in our area? What now it's 2 or is it 3 now? It's 4 now?
Yes.
Okay. So what is the rest of the Dow?
What do you mean?
What's the rest of the Dow?
Now what is geared toward? Yes.
You know, and like, you know, you go every, you know, so I mean, you look at that, you look at who's in control of pushing, you know, record playing a song means sales, and who are they trying to push and sell? But the issue about the appropriation, am I saying that right? Appropriation of our culture and those things, those still exist. You know, I mean, that's been it, like from the days of Elvis. You know, I mean, you had Little Richard, and he never got the acclaim that he should have gotten. He was, you know, him and Chuck Berry, you know, they created that genre. You know, they were the leaders of that. You know, even with country music, we were the leaders of that.
Right.
And now we're on the outskirts of it, seeping back in, you know, to it. The banjo is an instrument from Africa.
Yes.
You know what I mean?
Educate the people. Educate.
Yeah. I mean, you know, so
I will say this, having some experience in radio, I will say this. Let me take it back. Back in the day, you didn't have a lot of urban stations, and they considered that crossover music. You know, when you have go out there, it was crossover music. You have Michael Jackson, you have Whitney Houston, you had them, they crossed over. So boom, there you go. Other stations were playing their music and not just urban stations. Now, when you think about, go ahead, did you want to intervene?
I was gonna say, and to add on to that, I remember when this is not really a long time, but when Mariah Carey and Busta Rhymes had that song together, if it was played on a top 40 radio station, they did not play the version with ODB, and that was the only reason. That was the only thing that really made that song hot to me. You know?
Right.
Yeah, and I think, wasn't it originally released as a duet? It wasn't released as a but somehow the industry. So you can't even necessarily blame. I mean, you can blame the radio station to an extent, but you gotta blame the industry to say, well, let's just take the black off of that. You know, let's just swipe the black off of it. Right. Anything we think is too black, let's take it off.
Mariah was classified as pop though, because she was classified as a pop singer, honestly, because if you think back, like with Whitney Houston, How Will I Know? That song, you know, that's more like Mariah. But what I wanted to say was, you didn't have a lot of urban stations back then, and then they crossed over. It was like, yeah, I made it. But now I want to talk about Stephanie Mills. Love Stephanie Mills, but you have to be with the current. You have to be with the current. How many current young people are singing R&B? You know, how many young Black people are singing R&B? Adele was like the new thing. Justin Timberlake, he a little bit aged, but he's still out there. And they're, like she said, they're pushing that, but that's what's selling. So when you are in the business to make money, that's what you're doing. You're in the business to make money. You're not having, what's the last song that Stephanie Mills sang? That what was it? The Wiz, when she was in that, like, you know what I mean? And I like Stephanie Mills. I like them. Listen, I like Stephanie Mills. Don't get me wrong, but what I'm saying is, what new did you put out? You know, what are you doing? Honestly, and who else does she compare to? Can't nobody say nothing about Michael Jackson. Y'all better go on ahead. You know?
Who you talk? Is he talking about Stephanie Mills? The soul
Yeah.
Yeah, yeah.
Mhm.
Who would you compare? I mean, her to me, her obvious comparison was what's her name? She's some Body and Soul.
Anita Baker.
Anita Baker. They were on the same plane.
Okay, and I'm glad you brought up Anita Baker. Let's be real. There was a song that Babyface wrote. I want to say it was Babyface. Yeah. For Anita Baker, and Toni Braxton came in on the scene, and she sampled it for them to send to Anita Baker. And Anita said, "How come she can't sing it?" I.e., y'all know Toni D. Braxton. Okay, so it's like when you move out the way, you don't have to move completely out the way. And this is just, for Stephanie Mills, what her comment is, she seems like that they're pushing white R&B singers. Yeah, I think that's great. If you can sing, you can sing, but I don't think that. I think they're current. So come out with something new so we can push you.
I think the argument is the same. I think our argument is the same argument that what was the original mother from the
Janet Hubert
from the Fresh Prince of Bel-Air, and I think what she's saying from her perspective is that, like, hey, there is a pathway for you to fill these gaps or to give other artists these opportunities, and it just seems like the only time.
Before you argue it, come out and say that they haven't done it.
Now we have what is called neo soul. That is basically the old school R&B, the neo soul singers.
I don't think so. That's your India Irie, your music soul child.
Yeah, that's kind of like the old school R&B.
Every little step I take.
The R&B singers now are more, they're gearing towards hip hop. They actually don't classify them as R&B singers. They classify them as R&B and hip hop. So she's talking about the straight R&B.
Probably because of the collaborations, a lot of the collaborations. But I mean, give me a black R&B singer right now.
Woman or male or female?
Sullivan.
Any.
Jasmine Sullivan.
Okay.
I
mean, current, a new person, or
like younger, with the Adele, that little girl, the Chloe girl,
that I can say, hey, this is going to be the person that's to truly sing the national anthem. That kind of, or
yeah, there you go. Yes. See.
And maybe I'm just at a loss for it, but I'm speechless. I know they would let some other people have that opportunity, but it wouldn't be like if we were to say the word songstress. You know what I mean? Like
I real singers.
Yeah, because the
Jennifer Hudson.
Yeah, Jennifer Hudson. Yeah.
So
okay.
we do have new R&B singers, like I said, Jasmine.
Asia came out. She sells out. But I really don't know any that's to the level where these legends are. You know what I mean? Like, I really don't. Asia has her own style. But
it could be song quality too. It's like, who's writing for you, who's producing your music too. I mean, because like immediately when I thought about the category, and I was not trying to say her, was out my always go to is Jill Scott, but
she's more or less neo soul.
Yeah,
that's out, but it could be the quality of the tracks. It could be what do we have sensationalized in our communities that people, like are people trying to make that solo album anymore, or is it, hey, I got an album but I got everybody on it?
Everybody trying to be Dr. Dre until they get hit with them divorce papers at the funeral, huh? So you're right, the quality of the tracks. I'm with you on that. Go ahead.
I mean, Adele probably, she probably has top notch writers and everything like that. I just think like maybe the avenue isn't as, and not to say it was easier then, but we are and I shouldn't even say this, people might throw stones at me, but we're kind of like a post Motown generation. You know what I mean? Like where's that place that's like pumping out
in there?
Yeah, I mean, like you have black record labels and stuff like that, but who's that person focused just on this is the sound that we going for, this is what we're doing, this is the place to go. I don't know if that exists.
You brought up a great point, and that is it. Exactly what you said. Who is that person? So you got to find new people. And Nick, you got a good point, because you're right. You have that music, and everybody's having that same sound. So it's more hip hop. Going to hip hop producers to have R&B. Like, well, Aaliyah, I'm sure Aaliyah says she'll still be popping. You know what I mean? And that's R&B.
Yeah. She would be bigger than Beyonce. Sorry for the Beehive. I'm sorry to tell y'all, but I don't know if Beyonce would be. I mean, I'm not gonna take nothing away from Beyonce. You're a talented young lady.
Aaliyah,
but her and Aaliyah.
Yeah. What's your thoughts, Rubo?
On that, I think there would have been enough room for them to both play in the sandbox. However, I just think like after all this R. Kelly stuff, if the Aaliyah situation, I mean, unfortunately, it ended in that tragic accident, but there might have been some other issues she might have faced.
You know what? She wouldn't have had any backlash because that Age Ain't Nothing But a Number was R. Kelly, and then she left and went to Timberland and Missy Elliott and went with their.
Yeah,
so she still would have rocked.
Yeah.
She still would have rocked, but that Age Ain't Nothing But a Number album.
That's true. That's true.
All R. Kelly.
I stand corrected, because I was more or less talking about the personal relationship. I don't know how that would have all panned out. But
Age ain't nothing but a number. Big red flag. Red flag.
But like I said before, if I had my choice of singers at my wedding, I wouldn't choose neither one of them. But that's just my.
Who would you choose?
Oh, I would pick Jennifer Hudson. Jennifer Hudson would be a good person. Can I? Is it any time period?
Yeah, the current.
Any person? Aretha Franklin.
I knew Aretha Franklin. We knew that.
Oh, you know what? Y'all didn't really talk about Mary J. Blige. I'm not, I'm not really particularly a fan of.
She's more of a hip hop type. I mean, she's the R&B and hip hop.
You seen her when
she can go either way.
When she was dancing, she hopping across the stage.
Yeah.
But yeah,
I mean, she can actually go either way.
I mean, she was changing a little bit.
In her earlier years, it was more like she was a part of that blended culture of R&B and.
What's the 411?
Yeah. But it seems like as she's grown, like I don't really know too many collaborations she's done, but I don't listen to her either, so I don't.
Right now,
wait a minute, y'all forgot about Faith Evans.
Faith Evans.
Kiki Wyatt.
Kiki Wyatt. If she could just stay on task. All right, well, we're coming to the close of the show. Gotta close it. But I want to say this. Sometimes you can't replace the old. And the example would be like the Young and the Restless. You can't have nobody else play the woman. You see, can't nobody else play Miss Chancellor. They just let her go ahead. When she died, it was over. No more. So sometimes replacing the old is just a no-go. We got to come with the new and introduce something new. So hopefully the young people are listening. Stop using the old tracks. Stop P. Diddy and everything, using the old tracks and not paying homage to the people who actually started and the legends. And come with something new and fresh, okay? Today's footnote, the difficulty lies not so much in developing new ideas as in escaping from old ones. And that's from John Maynard Keynes. All right, got to put that out there. Hey, lovely people, I truly appreciate you for tuning in and listening to Shop Talk with Mel. You can hear us on all streaming platforms. YouTube, on your favorite podcast, just type in Shop Talk with Mel. Shop Talk is one word, but it still should come up, okay? Find you, embrace you, most importantly, always love you. Until next week, people!
Shop Talk!
Shop Talk!
We almost got it. We almost got it.